You Health Chat is a show that covers a variety of health topics to help people take control of their health. It is proudly sponsored by national medical stores who are mandated to procure, store, and distribute essential medicines and medical supplies to public health facilities in Uganda.
A very good evening to you watching UBC TV. Thank you so much for joining me, Sophia, on You Health Chat. And of course, we're here to share with you a lot that happens in the line of health, a lot that you need to know, a lot that you might know already, but I'll still say there is that bit that you do not know. Well, today, as you have seen from last month into this month, the focus has been on hospital facilities coming out down, or the medical fraternity coming out to us to say, hey, come out and check how is your health faring. Last week in the edition of the show, you do remember I did mention with you something about Olusisida Ruobulamu, which is a health camp that has been dubbed that by a hospital that is called North Park Specialist Hospital that is found in Balwa. But I said, you know, we are tired of hearing some of these things. The talking is way too much. Let's get down to the health camp and see what exactly happens. I'm in Bala right now, and with me on set, who is going to be sharing with us, is none other than a specialist doctor, and that is Dr. Edmond Odul, who is an orthopedic surgeon. Now, they're the ones who are here, and maybe that's why it's called a specialist hospital, because he's one of the specialists down here. Doctor, a very good evening to you. Thank you. How are you? Now, tell me a little bit about the hospital. It seems to be one I'm personally hearing for the first time.
Yeah, so thank you, viewers. We are glad to have you. North Park Hospital, known mainly as North Park Specialist Hospital, was an idea conceived by specialists about 3 years ago. From the name itself, our attention is to detail, providing specialist care in an excellent manner and bringing all this kind of care to the community. You and I will agree that the kind of services that you'd expect from a specialist center most times may be within the city center. But we are saying that we should change the trend of things, because the patients who follow us to the city center are actually not from the city center itself. So we said, let's set up within the community so that we provide the same service, the same quality of service in an excellent manner in the community itself. That's how North Park Specialist Hospital came about. And it was formed by a team of doctors who are specialists. All of us are specialists in our different fields.
Mm-hmm. Now, when you say a specialist in your different fields, you've opted to permanently settle here, and we do not find you in any of the other hospitals in these city centers and in the outskirts, say like outside Kampala?
No. When we say we are specialists, we mean that most of us are mainly in the private sector. Okay. That means that sometimes we also work in some other hospitals, especially the private not-for-profit hospitals, like say in Zambia, in Mengo, Rubaga, private not-for-profit. But we also said, we know we need to establish something which is more accessible, okay, which is more affordable, but the same quality of service to the community. So when I say we are specialists, means according to the Uganda Medical and Dental Practitioners Council and the criteria of grading of doctors in Uganda, as well as according to Ministry of Health. A specialist is a medical practitioner, okay, a medical doctor. You finish 5 years of training, do internship for 1 year, then you go back, you train maybe for 1-2 years. Like for my case, I had to train for 2 extra years before going back to school. So going back to school, you have to spend another minimum of 3 years to train in that clinical discipline. Be it orthopedics, which is 4 years, neurosurgery, which is about 6 years, be it pediatrics, which is 3 years, obstetrics and gyne, which is 3 years. Then you obtain that other extra degree, because that now makes you to focus on one thing. So you focus. Before, when you finish as a medical doctor, you are doing a lot of things. You're treating mothers, you're treating children, you're treating older people with the chronic diseases like hypertension, like diabetes. You're treating people with the surgical issues. But now you say, no, let me focus. I want to be better in one thing than not being good at everything. Yeah, so that is why we chose to specialize. And you find that at North Park, all these disciplines are very well represented. And it will be even interesting, I think we can discuss this along the way, that even some of us have gone further than that to now do what you call super specialization. So you'll find that we established this service point within the community because we feel that people should benefit from these services, from these people, these brains that are actually living with them in the community and they know nothing about. Don't rush to go to India when actually your neighbor in Imbalwa can solve all your problems. Yeah, that is what we are trying, and that's why we called for this, so that we inform the community that the kind of care you desire is actually next door. The kind of people, the doctors you want to treat you, are actually your neighbors in the community. So the accessibility is clear, affordability is top class. This is not super expensive, but I'll assure you, your life is very safe with us.
Okay. Now, in terms of what you have said and how you have specialized, with the 3 years the hospital has been in existence, what are the major cases that you're seeing, that you're dealing with? There might be those that you've specifically highlighted, and there might be the emphasis for which you decided to say that, hey, free consultation on a specific day, the medical camp that you're having.
Yeah, I, for one, I have a lot of patients. I think most of them will be waiting for me. We have lots and lots of patients with back pain, okay? Even research shows clearly that out of 10 of us, more than 6 of us will be suffering from low back pain, okay? So we have a lot of patients in the community with back pain, and they're suffering without knowing actually that they can get treatment easily. And people come with a lot of knee pains. Osteoarthritis is very common in the community. Then when you go further to other disciplines, obstetrics and gyne, we have lots and lots of mothers with questions, with the conditions where they need the help of a gynecologist. We have many of them come. We have a very well set up or surgical theater here, where we actually carry out a lot of very complex, okay, surgeries. Then you go down to the other disciplines. We have internal medicine well represented, and we have the top-notch, top brains in internal medicine well representing us here. We have a nephrologist who actually doubles as our medical director, okay? We have a pediatric cardiologist who is part of the team. This is someone who trained in pediatrics, then went ahead to only focus on the heart, okay? Nephrologist trained and in internal medicine, then said, no, I want to only focus on diseases of the kidney, okay? These conditions are becoming more and they are becoming more common in the society, and we need to bring them close to the people. On the team, I won't forget to mention that we have surgeons of all kinds. There are those who just want to do penile surgery. We have them on board. There are those who are neurosurgeons. We have a neurosurgeon on board. We have a pediatric surgeon. He only focuses on children. Okay, so all these people are very well represented.
Wow. Now, what was the focus and the emphasis for you to decide to say, there are certain times people think the medical industry is about you people making money, yeah? And we see almost everywhere a lot of private hospitals mushrooming. What was the focus for you to say it's time for us to give back to the community and have a free health camp for them?
That's a good question. Actually, it came to our mind that most of the time, the hospitals you see mushrooming are either they're focused on the economic benefit of running an institution, a medical institution. But as doctors, we feel we need, the first priority is the patient, okay? Priority is the patient. If the patient can get the best, okay, then that patient, that is the best outcome that we desire. Yes, we need money at the end of the day, but the money we need is mainly to maintain the quality of the service that we want to offer to people. Of course, at the end of the day, it's also beneficial to us as doctors, because as a medical doctor, you're not only there you have families. So you do the trade that you know best. We know medicine, so we want to also focus and use it as an avenue to change lives of the patients, but also change our lives financially. But that makes it actually better in one way, because my focus on the patient is not to make the money. My focus is to get you the best treatment and get you back on the road so that you make the money. The little money you pay here is to just maintain the hospital and maybe give me a bit of financial accomplishment from my side. But for me, like now, if I talk of orthopedics, my attention is to get you with a fracture, fix you, go back and make money. Okay? Yeah.
Now, at the health camps like this, do you gazette and target out that these are the areas you're going to look at? Because given the fact that I believe most cases during some of these camps, you're bound to find people with multiple complications who have always waited for an opportunity, or like they're now, why shouldn't I go in for free? Are you planning to just examine them, observe, and if they don't have the financial resources to go through the treatment plan, advise them otherwise, or what is it like?
No, one thing that we have discovered within the community is that most of the people in the community are ignorant of the services. So our topic, our being here today is actually to create awareness, because you need to first of all be aware of your condition. Then you know what it will take to treat you. Most of the time we have patients in the community and they are completely unaware of their conditions. Say for example, mothers, you need to come and listen to the gynecologist and they tell you, you talk to them, find out about the common diseases that are killing us out there: cervical cancer, cancer of the uterus, cancer of the ovaries, and they are seated down there. Come and listen, talk. You might find that actually you're sick and you don't know, so that specialist can advise you on what to do. You may not be able to do it today, but at least it will open your eyes to say, you know what, I need to see more, I need to seek more attention, find more medical attention about my condition. So here we are not, today it's not about treating everyone. Oh, come, we treat you from 0 to 100 and you go back perfect. No, but it's awareness. Come, find out what is North Park Specialist Hospital. Who are the people at North Park Specialist Hospital? Which services can I get from North Park Specialist Hospital? Instead of saying, oh, now you get a patient is in an accident, gets a fracture, then you completely think, you don't know that there is actually a hospital in the neighborhood that can handle your condition very fast and in a much, much better way, okay? Some people forget and they go to the traditional bone setters, okay? Because they don't know there is help next door. So this camp is for awareness. We are saying that know your health and you live a good life. That is our theme for today. Know your health and live a better life, okay? Because without the knowledge, the people perish.
Because how this you're doing only once a year, yeah? How else do you intend to support them? Because there are certain times we have a very bad notion and belief you only go to the hospital when you're unwell, which is what the layman believes or thinks. Beyond that, they'll just bypass most of these health facilities and they can't care less.
No, actually, I would like to correct that. We actually do this every quarter. This is our second camp. Our target is that after every 3 months, we come to the community and create more awareness about, make them know about their health. And we partner with very many service providers to make sure that this happens, of which one you have now come on board, and we really appreciate that, so that at least this message can reach people out there. So this is just the second. We started in I think January. We had the first one. Around July, we are likely to have a third one. We target to have at least 4 camps every year to create awareness of all these common conditions and even the complex conditions that people have in the community.
Okay. Given your expertise and experience from the one of January, what was the turn-up and what were the major issues you identified? In terms of we as the community, what were the reported, you put down your records and you're like, malaria was on the high, or if not so maybe it's non-communicable diseases. What was your observation?
It's so clear that we had a very good turn-up. Actually, we planned that camp on a very short notice. That's why we didn't, not very many people were aware of it, but we had a turn-up of about more than 100 participants, and we had it within just 6 hours of the day. So 100 people in 6 hours, but that was just to enable us make a community diagnosis of how much the problem is out there. And we found out that actually out there, especially in our community, we have a lot of non-communicable diseases. We have lots of people with hypertension. We have lots of people with the arthritis of all kinds, especially osteoarthritis of the knee. We have a lot of people with back pain. We have lots and lots of people with gynecological conditions. There are children with developmental, with disabilities in our community. And that's what pushed us to say, you know what, we need to have this more frequently so that we can attract some of these people, make them aware of their condition, and also we tell them the treatment path that they can take. Yeah.
Now, I know certain times one of the biggest challenges in our health, health setup in Uganda is the gadgets. That is why maybe sometimes people will opt to run to the neighboring countries where they believe that this might be. How well equipped are you as North Parks, with the specialists you being here? How well equipped are you to save us the burden of running out of the country to go for some of these treatments?
We are very well equipped, I'll say that, because the most important equipment is not the instruments to use, it's not the infrastructure. The most important equipment is the human resource, yes, of which we have in abundance. Like I already mentioned, not to thump our chests, but we have a list of the most brilliant people within this institution. For example, we have our nephrologist here, who also doubles as the president of the Uganda Kidney Association. Okay? We have our gynecologist here, who also doubles as the president of the Uganda Association of Obstetricians and Gynecologists of Uganda, and is a gynecological oncologist. That means he specializes in cancers of women related to their reproductive system. So we have all these brains. Others, we have our chairman board is one of the most renowned diabetologists in town. Okay? We have, if I'm to mention, one of our members here, she's actually a renowned physician in town, and she's actually the head of department of internal medicine in Makerere University. So we have a team, a formidable team, if I may call it. So you have a lot of brains within here to solve any problem, okay? I won't forget that we have neurosurgeons, pediatric surgeons, pediatric cardiologists, neonatologists. You have an orthopedic surgeon seated in front of you, okay, with the interest and focus in spine and joint conditions, okay? So we have all the brains that we need. So for us, we are saying that let's bring the brains closer to the people, and the infrastructure is actually state of the art, okay? Our theater is state of the art. The infrastructure here is state of the art. Above all, the quality of our service is second.
Mm-hmm. Now, talking about some of the things that you've talked about, how are you planning to change the mindset and believability? You know, there are certain times people get attached to the name of the hospital. The name of the hospital plays a very big role, where somebody feels, unless if I am in that hospital, you can't convince me otherwise.
There is actually no direct, because this is the health service. We are more inclined to providing ethical service. We are very professional. We are very ethical in whatever we do. So rarely are you going to find us out there to focus on how to sell the name of the hospital. We are focused on selling the service that the hospital provides. So that if you test the service at North Park Specialist Hospital, then most likely it might be the household name you will be mentioning the next day. I believe that those who have been through North Park have never remained the same. And they call, this is the only place where you can have 10 doctors, only place in the community, not within the city of Kampala. We are in Wakiso. Only place in the community where you will have 10 super specialized doctors attending to you. Not because you're a very big man at your place of work, but because you are a patient and you matter to us. So we are selling the service. We are saying, come, see the service for yourself, and then if it's not okay, tell us where to fix. But if it's okay, come back, make it your hospital.
Then what about the bit of like, when you talk about the community, yeah? Many people, honestly, because many people really have challenges in terms of valuing the cost attached to health. Some people can afford, but some cannot afford. What is the plan that you have for those who cannot afford, but they do need the service?
We have been having that at our many meetings as a team, and we feel that this we can always have one-on-one with the patients. We are trying to come up with a system where patients can actually easily afford, not in form of because right now, even when you talk of insurance, the penetration of insurance in Uganda is about only 2%. And most of the people access health paying from pocket, which is very difficult, and we acknowledge that. But that should not deny us quality service, okay? So North Park is one place where you can come and we sit down and we discuss. But we see how to help you, and we see how to help you, not just to get the treatment, how to help you afford the service, okay? How to help you afford it. We can have a negotiation, because if you're honest, the hospital is always very honest with you and say, you know what, we understand. We have very many instances where we have treated patients and they have gone back, continued with their work at whatever place they are in, made the money, and they came back and brought back the money to the hospital. So it works two ways, so that for the hospital to continue providing the quality service to you, we are preying on that honesty. You come, we discuss how you can afford the service, and we work out a plan so that you're not denied, because life is the most important thing. And not only life, but quality life matters. Yeah, me as an orthopedic surgeon, I focus more on the quality of life, not just the existence of life.
Mm-hmm. Now, on your expertise and your specialty, based on what you say, that you're seeing a lot of people with the back problems, what is the cause? Has it got to do with age? Has it got to do with our sitting postures? What exactly is the cause?
It's actually a combination of everything. One, society has evolved. We know that we eat differently nowadays. We work differently. Most of us, you wake up in the morning, sit in the car, drive to office, sit on your desk, get out, sit in the car again, drive back home, sit on the sofa. So some of those, like you mentioned, sitting is also, generally sitting is not good for your health. Two, we have people we have different things that we do. There are people who are more predisposed to they lift a lot of heavy weights, and there are people who generally the weight that they have is also increases the risk of back pain. But at the end of the day, diseases always, we are all predisposed at different levels, genetically. That's why I always tell my patients, you will find that an old woman of 75 may have never had back pain, but a 35-year-old has back pain. So it has, you can't delineate it away from genetics and also the environment where you stay. Yes, so we are having most of these things coming up because also society is evolving. Yeah.
Okay. Well, at this particular point, I'd like us to take a very short break, and when we do come back, we'll still be taking you more into the importance and why you must attend health camps, why you must get these services, and of what benefit they are to you. Welcome back from that short break. You're still watching You Health Chat. And of course, today we have gotten a bit to go down to one of the hospitals that's been holding a health camp called Olusisira Luobolamo. Why they chose to dub it that way, I think, is to attract more of the people in the community. So the name is closer to the community. And I'm talking to none other than Dr. Edmond, who is a specialist, and he's taking us still into the matters. Now, doctor, what services does the hospital offer?
Yeah, North Park per se has, or I would say, offers a whole range of services, ranging from medical care to surgical care. You know, in medicine, there is medicine and then there is surgery. The difference between the two is how you treat the patient. We surgeons sometimes go to the extent of cutting you open and stitching you back, yes. and to make sure you have a better life. So we have a whole range of medical services, pediatric care services, and the pediatric care services range. We have a vast number of specialized individuals in our pediatric department. We have those who are cardiologists, they deal with the heart. Those who are pediatric surgeons, they operate young, small children from around the age of, even when they are still in the womb, up to the time when they are 18 years of age. We have pediatricians who are focused only on the tiny babies, those who are below 28 days, call them neonatologists. So in pediatrics, there are a wide range of people. Then you have people who have done, we have internal medicine services. These are physicians. These are, we call them adult doctors. There are people who deal with your kidneys, people who deal with diabetes, hypertension. They deal with your heart, we call them cardiologists. Okay, so we have a very big number of them offering their services here at North Park. When you go to other disciplines, I don't want to forget mental health. We have one of the most active and one of the best psychiatrists you can come, who can offer you the best services here. We have a very active clinic, psychiatry, to take care of our mental health. Does not mean that I want to throw away this norm out there that psychiatrists only treat mad people. No, that is not true. We all have mental health needs. Okay, doesn't mean that I'm a doctor so I don't suffer from malaria. When I suffer from malaria, I go and get treatment. So mental health is the same way. We all have needs mentally to help us function better in society. So we have a psychiatrist who is here every week, at least twice a week. Okay, he runs a very good and very active clinic here. So you come to services like ear, nose, and throat. We have a lot of people with hearing difficulties. You have pain. People talk of sinusitis in the society. We have all of them available here. Throat issues, you have difficulty swallowing, come and see the ear, nose, and throat specialist. Then you go to neurosurgeon. We have a neurosurgeon on board who can help you if you have we have an ICU here. You have a patient has had head injury, has questions about that link to their brain not being in the right place. Please come. We have the surgeon available, can assess you, and the treatment can be done from here. We have all the resources necessary to carry out the treatment. Then I shouldn't forget the surgeons, general surgeons. We have endoscopy, and they can use their cameras and look into your stomach. Make sure, most of us complain of, I have ulcers. No, you come and we show you that the ulcers are there. And we also take off samples and we test the ulcers, because sometimes it may be cancer of the stomach and you don't know out there. I shouldn't forget my own discipline, orthopedic surgery. We are 2 orthopedic surgeons here. Okay, have back pain, knee pain, any patient with a fracture, bring them and let's treat them. If you have fractures, come, let's treat you. You go back and continue with your work in the community. You shouldn't stop earning because you've broken your bone. Okay, you should come, get treatment very fast, go and continue making the money. Then other services that support us here to carry on all these medical and surgical services. We have a very good and vibrant lab. We have all the tests available, okay? We have all the tests that you can carry out. If we need to take it to South Africa, we shall take it ourselves, okay? So that you get that test that really helps you to live a better life. We have the imaging studies done within the facility that helps us also to make good decisions about the treatment of the patients. We have an excellent team of nurses. I won't forget about that. I would always say braggantly to my colleagues that our nurses are second to none, because they have that touch of healing. They have that touch of caring for the patient first before everything else, to an extent that we even roll out our services to the community. We have home care nursing. If you need nurses to come from the hospital to come and take care of you in the community, we can actually come and take care of you in the community, plus a doctor as well added on board. Then we have a lot of wellness clinics that take place. This includes teaching you about your nutrition, teaching you about how to keep healthy, how to take care of yourself, teaching you, sometimes we involve the physiotherapist to help you. Physiotherapists are medical practitioners who deal with painful maybe conditions of the body, but by using physical means like massage, exercise, and other modalities to try to treat these conditions. So we could talk a whole range. That's why we're in the community making people aware. All these services go to the level of super specialization, not just specialists. In fact, we should have named the hospital North Park Super Specialized Hospital, but we shall maintain it at the specialist hospital because we know that the services will actually exceed the specialist level. Yeah.
Now, there are certain times, like if you went to some of the hospitals, you'll know that if I want to go and see the thyroid clinic, maybe this is happening on a Wednesday. Do you have gazetted days as to when somebody can find the given specialists? If we know that it is ENT, then ENT clinic is on Mondays or so. Do you have your days gazetted?
Yes. We have, from Monday to Friday, we have clinics that run. For one, I run my clinic on Wednesday. Yes, so you can just call in. We have a WhatsApp number that will be provided by the management team. You can call in and say, no, I need to see so-and-so. I need to see an ENT surgeon. I need to see an orthopedic surgeon. When can I come and see? And they will work together with you and make sure you see that person on time.
What are the best moments you can say, you speak about when it talks about when we get to the health camp of January? Because fine, there is doing something and there is looking at it with all the partners you had on board and you're like, it was a total waste of time. But I believe there is that push factor that even got you to say, let's go for second camp.
Yeah, we actually found out from that camp that many of us are out there with diseases and we don't know. For example, we had a very big number of people who never knew they were hypertensive. They didn't know they had high blood pressure. They kept coming with weird symptoms, okay? We had a lot of people who didn't even know that they had diabetes. They came, we carried out tests, and they were surprised, and we linked them up to the care. We linked them up to have the right kind of care. In my own discipline, there are very many people who had questions about their back pain. They didn't understand what back pain is. There are people who don't know what arthritis is. You see in the community, people tell, arthritis is this. There are people who came here with the hernias and they didn't know the repercussions of all these things. Okay? There are children who have disabilities, they have deformities, and mothers are worried. So they didn't know what path they can take to have their children children treated. So that is what actually prompted us to say, you know what, this shouldn't only be a one-time thing, because we are seeing the positive side of organizing it. If we can make people aware of their health, then they can live a life filled with the knowledge of themselves, and they can have a better quality of life. Yeah. So that is what pushes us every day.
Okay. As it pushes you every day, for some of them, how responsive have they been? Have they still come back after the follow-up from the first diagnosis or examination that they went through the health camp? Have they become regular and consistent and learned out, like let's assume, diabetes? When you find out, you just don't leave it at that, and they know that this is the plan I have, this is how I should go about it.
Yes. I would say over 70% came back and started the following up with care. And some of them actually who had surgical needs ended up being treated from the hospital here, because we followed them up, helped them go through we had the investigations done, and we operated them from here, and now they are living good life in the community, quality life within the community, and they are back to earning a living, which is quite important. Yeah.
Mm-hmm. As a specialist, what is your word to a person who is watching you right now?
As a specialist, my word for the day is that you no longer have to travel long distances to access specialist care, because specialist care is actually closed door to you. And let's not wait until it is too late, okay? Because everything else is time bound. Let's not wait until it's too late, then we come to seek for help. Because sometimes you kind of you put the specialist in a very hard situation. Wants to help you, but where the disease has reached, the specialist can't now help you. So you have the specialist in the community. North Park Specialized Specialist Hospital is here to stay, okay? Come, get checked, talk to the specialist of your choice, depending on what you're suffering from. Let us help you make the right treatment decisions, and let us help you get out of the situation that you're in. Yes.
Okay. Thank you so much, Dr. Edman. It's been very nice for you to share such useful information and for taking the services down to the community. Well, lucky are those who live in Mbalwa, but not necessarily. You can also traverse from whatever area you're at to be able to get specialists attend to you. That is all we had for you tonight on New Health Chat. Keep watching UBC TV and catch you next week, same time.
Yeah.
UBC, inspiring Uganda.